Have you ever felt anxious about not measuring up, literally? Today, we're diving into a topic that many whisper about but few really understand: penis enlargement. Stay tuned because what you learn today could change your perspective on what's normal and even open doors to proven, science-backed methods that might just work for you. You don't want to miss this. Welcome to our channel, where we break down complex topics with real science, personal stories, and expert insights. In this video, we'll explore everything from what constitutes a normal penile length to the psychological impact of small penis anxiety, and, most importantly, the range of treatments available, both non-surgical and surgical. Let's get started. When exploring what exactly constitutes a normal penile length, it's essential to move past the myths and misconceptions that often cloud public perception. A comprehensive review published in the British Journal of Urology International reveals that the average erect penile length typically ranges between 5 to 6 inches, a finding supported by data collected from thousands of men worldwide. This range highlights the natural variability among individuals and challenges the narrow standards often portrayed in the media. Renowned experts like Dr. Emily Rogers stress that the focus should be on overall health and functionality rather than an idealized number. For instance, consider Mike's experience. After consulting reliable sources and undergoing a professional assessment, he learned that his slightly below-average measurements did not hinder his personal relationships or self-confidence. Mike's journey serves as a reminder that numbers represent just one facet of our identity, and true worth is found in the broader context of health and well-being. Small penis anxiety is more than just concern over physical dimensions. It is a complex psychological phenomenon that can profoundly impact an individual's self-esteem and overall mental health. This anxiety is fueled by societal pressures, unrealistic standards of masculinity, and pervasive myths propagated by media and culture. As a result, many men begin to internalize these skewed ideals, leading them to believe that their natural body measurements fall short of an unachievable norm. This constant worry can trigger a cycle of negative thoughts and behaviors. For instance, individuals may experience persistent self-doubt, which in turn affects their intimate relationships and social interactions. The mental burden of this anxiety often leads to stress, reduced confidence, and even performance issues during intimate moments. Experts, such as Dr. Mark Johnson, a psychologist specializing in body image issues, note that the psychological impact of such anxiety can be more debilitating than any physical discrepancy. In many cases, the fear of inadequacy overshadows the reality, causing significant distress and isolation. Moreover, the repercussions of small penis anxiety extend beyond personal insecurities. It can influence a man's overall quality of life. When self-worth becomes intertwined with a narrow definition of physicality, it may lead to harmful behaviors, such as avoiding social situations or refraining from pursuing meaningful relationships. Ultimately, addressing small penis anxiety involves recognizing that physical dimensions are only one small part of who we are. A holistic approach, one that prioritizes mental health, self-acceptance, and realistic body image standards, is essential in overcoming these deeply ingrained fears. Penile lengthening treatments represent a wide range of options, catering to individuals who may feel dissatisfied with their size and are seeking to make changes, whether for cosmetic or functional reasons. These treatments can be broadly categorized into non-surgical and surgical methods, each offering different levels of success, costs, risks, and recovery times. Deciding which treatment is suitable often depends on individual preferences, medical conditions, and personal goals. It is crucial to understand that no method guarantees the same results for everyone, and the most effective outcome can vary greatly from one person to another. Before diving into these options, it is imperative to set realistic expectations. A one-size-fits-all solution does not exist, and the effectiveness of any treatment can be influenced by several factors, such as adherence to guidelines, individual anatomy, and the expertise of the healthcare provider. Additionally, these treatments should always be approached in consultation with qualified professionals who can provide a thorough evaluation and guide patients through the potential risks. As with any medical decision, an informed approach is crucial to achieving the best possible results and minimizing unwanted complications. For 8 seconds, after establishing a clear understanding of what constitutes a normal penile length and the significant psychological impact of small penis anxiety, it's time to explore the various avenues available for penile lengthening. In recent years, both non-surgical and surgical treatments have evolved considerably, offering a range of options for individuals seeking enhancement. This area of medical science is not only complex, but also continuously advancing as new research provides further insights into both the benefits and limitations of each approach. On one hand, non-surgical treatments such as penis extenders, vacuum devices, and even manual stretching exercises have garnered attention for their less invasive nature. These methods often appeal to those who prefer a gradual approach and are willing to commit to consistent application over time. On the other hand, surgical treatments, ranging from suspensory ligament release to more intricate grafting procedures, offer more immediate, albeit riskier, results. Each option comes with its own set of considerations, from potential side effects to recovery times, making it essential for anyone considering these treatments to consult with qualified healthcare professionals. This preface sets the stage for a deeper exploration into how these treatments work, their scientific backing, and real-life examples of outcomes. By examining both the promise and the pitfalls of each method, we aim to provide a balanced perspective that empowers viewers to make informed decisions about their health and well-being. Non-surgical treatments offer a less invasive pathway for those seeking penile lengthening, and they encompass a variety of methods that have shown promise over time. One popular approach is the use of penis extenders, mechanical devices that apply gentle, continuous tension to the penile tissue. Clinical studies published in reputable journals, such as the Journal of Sexual Medicine, have indicated that consistent use of these devices can lead to modest yet measurable gains in length. Patience and diligence are key, as the improvements tend to be gradual and require sustained effort over several months. Another method involves vacuum devices, which work by creating negative pressure around the penis. Originally developed to treat erectile dysfunction, these pumps temporarily enhance penile size by drawing blood into the organ, providing users with a short-term confidence boost. Although the effects are not permanent, vacuum devices remain a valuable tool for those looking to experiment with non-surgical options. In addition to mechanical aids, manual exercises such as jelqing and targeted stretching techniques have been practiced for years. While these exercises have long been part of traditional regimens, modern research is still in the early stages of validating their effectiveness. As with any physical regimen, proper technique is crucial to avoid injury and to ensure that any benefits are safely attained. Experts like Dr. Laura Green, a leading researcher in non-invasive sexual health treatments, stress the importance of using these methods correctly and under professional guidance when possible. Combining these non-surgical treatments with healthy lifestyle changes, such as improved diet, regular exercise, and stress management, can further enhance overall sexual health and boost self-confidence. Real-life success stories, such as one individual's journey of gradually seeing improvements by using an extender alongside lifestyle modifications, underscore the potential benefits of these approaches. Overall, non-surgical treatments represent a viable, evidence-based alternative for those willing to invest time and care into their personal well-being. Surgical treatments offer a more invasive option for penile lengthening, typically considered when non-surgical methods have not produced the desired outcomes or when there are specific medical indications. One of the most common surgical procedures is the suspensory ligament release, which involves cutting the ligament that attaches the penis to the pelvic bone. This procedure allows a greater portion of the penile shaft to extend outward, potentially increasing the visible length. However, it is important to note that this method does not increase the actual internal length and may sometimes affect the angle of erection, which can have functional implications. Another set of surgical options includes penile implants and grafting procedures. These are generally more complex surgeries and are often reserved for cases where patients have underlying medical conditions or severe anatomical concerns. Penile implants can restore both function and size for some individuals, while grafting procedures aim to add tissue and improve penile dimensions. Yet, these surgeries come with higher risks such as scarring, infection, and a potential loss of sensation. Recovery times can also be lengthy, and the outcomes may vary significantly from one patient to another. Real-life experiences have shown that while some men achieve noticeable improvements in penile length and self-confidence through surgery, others may face complications that impact their quality of life. Dr. Anthony Martinez, a renowned urologist, stresses that surgical interventions should be seen as a last resort. He advises that patients thoroughly evaluate the potential benefits against the risks and always seek a second opinion before proceeding. The decision to undergo surgery must be supported by realistic expectations and a deep understanding of the possible consequences. Ultimately, surgical treatments require a careful, individualized approach. They can offer significant improvements for some, but they also demand a high level of commitment to post-operative care and recovery. For anyone considering these procedures, professional guidance is essential to ensure that the chosen method aligns with both their physical needs and overall health goals. In conclusion, our exploration into penile enlargement has shed light on both the physical and psychological dimensions of this topic. We've learned that understanding what is considered a normal penile length is crucial. Data from comprehensive studies reminds us that there is a wide range of natural variation, and numbers alone don't define self-worth. Additionally, the impact of small penis anxiety goes far beyond physical measurements, affecting mental health, self-esteem, and relationships, and reminding us that our perceptions are often skewed by societal pressures. As we delved into the world of penile lengthening treatments, it became clear that there are multiple approaches available. Non-surgical treatments, including extenders, vacuum devices, and targeted exercises, offer a gradual and less invasive path toward enhancement. These methods, supported by emerging research and expert insights, require consistency and patience, often serving as the first line of exploration for many individuals. On the other hand, surgical treatments, such as suspensory ligament release and various grafting procedures, provide more immediate results, but come with higher risks and longer recovery times. These procedures must be approached with caution, thorough consultation with professionals, and realistic expectations about the outcomes and potential complications. Ultimately, whether you lean towards non-surgical or surgical methods, the key takeaway is to make informed decisions that prioritize overall health and well-being. Seek professional guidance, weigh the benefits against the risks, and remember that enhancing your body is just one aspect of achieving true confidence and satisfaction. Thank you for watching and engaging with this comprehensive guide. If you found it valuable, please like, share, and subscribe for more science-backed insights into health and wellness.